I've never thought about having any other career except for one. I told my mom I wanted to be a Major League Baseball player one day, and she said, well, they're all doctors in the off season. So it was good because I didn't have a good arm and I wasn't really fast. I wasn't a good hitter. So I went through high school and college and was majored in science and was attracted to neuroscience as a field. And at some point, the light went on that I could treat patients with brain problems. It became clear to me that everything that I had felt like was maybe an accident leading up to that point was all for a reason. And that led me to that moment to go into, I'd made the decision to go to neurology. There was never any question. The thing that really inspires me about neurology is being able to bring together different forms of evaluating a patient and bringing that together to make a diagnosis and figure out the best way to treat them. The patients that I treat primarily are stroke patients. Over the past 5 or 6 years, some major advances have been made that allow us to treat more stroke patients up to 24 hours after the time of their symptom onset. Our primary message in stroke care is that time is brain. The sooner a patient can get to the emergency department after the onset of their stroke symptoms, the more we can do. My approach when they get to me is to make sure that we've covered everything, that we're doing everything that we can to prevent another stroke. So my approach is to get them back to their community doctor and living their normal life as early as possible. I view patients and their families as equal partners in healthcare. We had a patient that was a private investigator that came to see me because he had hydrocephalus, had fluid on the brain, and he was having more problems walking. His gait was shuffling. He was having falls, which was something new for him. He was relatively young, in his 60s. And he came in, we did a lumbar puncture, and he did great. Before the test, he was shuffling and felt confused. We did the lumbar puncture, and after that, he felt like a new man. He returned to work, and he's been normal ever since. My name is Dr. Robert Hoesch. I'm a neurologist practicing at the Intermountain Neurosciences Institute.